What's up guys, Mr.Physio here in Australia, and today's topic is core. We'll go through 4 things today. Firstly, the 4 important components of core, how they can support your back, and then how we can improve their function. So the core consists of 4 parts. First one is diaphragm, covering the top of the abdominal wall, and the bottom part is pelvic floor muscles. And then you have spine and spinal muscles at the back. Lastly, you have a deep core muscle called transversus abdominis. It starts from the spine coming all the way forward and attaches on the front, surrounding the whole abdominal wall. So you've got skin, fat, and a couple of layers of the muscle, including six-pack. And then the deepest layer is the transversus abdominis. So it provides more support for your back, and it looks like a corset or champion belt. So exactly how it can support your back. When you think of the 3 parts of the core, they are contractile. Diaphragm does contract and relax, and I will give you an example later. But the spine, of course, is not contractile. So the first 3 parts change in length when you do things like breathing, exercising, and doing your business in the toilet. That means depending on these 3 parts of the core stability can be decided. In other words, the movements of the 3 parts can support your back. Imagine a water bottle that's made of rubber. If the rubber is very strong, it will increase the pressure within the bottle, and that pressure will hold everything upright, nice and tight. If the rubber is loose, that will allow everything to collapse. It will be addressed more in detail in the next video, but if your hip flexors is tight, that will pull your spine forward. At that moment, if the transversus abdominis is strong, that will push the spine back up, fighting against the hip flexor tightness, so that the pressure prevents spine from falling forward. But if your deep core muscle is weak, that will allow your spine to come forward, especially when you lean forward, picking up something from the floor like that. So if these core muscles are strong, that will increase the pressure within the abdominal wall, and that increased pressure will push the low back spine, preventing it falling forward. Another example would be patients with disc injury in their low back. When they cough, the pressure within the abdominal wall will increase too much because the deep core muscles will contract really hard. Sudden increase in that intra-abdominal pressure will push the disc back. The disc itself can be a little bit shaky for a short moment, so that can aggravate the disc symptoms, or it can cause the disc problem as well. So how can we improve their function? To activate your deep core muscles, you have to find these bony areas called ASIS. So this is my belly button, and this is my ASIS, and you bring your fingertips 3 centimeters in, 3 centimeters down. So a little bit in and a little bit down, a couple of centimeters. And then you're going to breathe in and out in this position. Before we start, you need to know transversus means horizontally. So if you contract this muscle correctly, it feels like the width of the waist gets narrower. Your belly kind of closes horizontally with your belly button going down a little bit at the same time. Think of your belly button as an antlion's pit or black hole sucking everything in towards your spine. So let's do it all together. Find the muscles 3 centimeters in and down from that pointy pelvic bones, and then breathe in and out while gently drawing your belly button in towards your spine, and try to contract your belly horizontally as if you're closing it down. Also squeeze your butt up to engage your pelvic floor muscles too. So if you do it correctly, you can feel your muscles swelling up a little bit under your fingertips. It's a bit different to tensing up your belly to push your fingertips out. Your fingertips are just there to feel your muscle activation. You'll naturally feel the tension under your fingertips if you do it correctly, so don't try to push your fingertips away. And then we're gonna work on that muscle eccentrically. In eccentric exercise, your muscle contracts while it elongates. So how do we do that? You can actually maintain that activation while breathing into your chest in and out. So find that muscle first and activate that muscle. And this time, you're going to maintain that contraction while breathing into your chest. So try not to lose your contraction under your fingertips and keep squeezing your buttock and then breathe into your chest. So I'm trying to hold that contraction while my ribcage goes up. So the whole ribcage goes up, which means this transversus abdominis will be stretched out a little bit. But this muscle keeps contracting because I'm trying to hold on to that contraction. And then I'm forcibly elevating my ribcage and expanding at the same time. That muscle fibers will be stretched out, which is eccentric contraction of that muscle. Of course, you need to breathe into your belly. That's normal breathing pattern. But it's a form of exercise. You train your muscle to control that stretching force, because a lot of times transversus abdominis has to fight against that stretching force. So in the previous example of hip flexor pulling your spine forward that way, that anterior pelvic tilt already creates a bit of stretching force on that, transversus abdominis. And naturally our belly comes forward with fat like this, and that will all stretch out this transversus abdominis. And when you lean forward trying to pick up something from the floor, the organ's weight together with gravity will put a stretching force on that, belly area. So a lot of times transversus abdominis has to fight against that stretching force. That's why we want to train that muscle in a similar way it's been used. So even though I've shown you today the lying position only, you need to incorporate this activation into everyday activities. You can probably start with static positions, like sitting at work, standing on a bus, but eventually you need to practice this in dynamic motions, like lifting heavy stuff, exercising in the gym, walking and running kind of thing. Basically anything you do in your life. That's the best way to improve your core function. I'll see you next time. Thank you very much. 완전 좋아요. 자연복대 기가 막힙니다. 하나씩 차 있어.